Management, thank you for sharing this information. Address the concern first. You mentioned you are worried about the infection, but you don't have any fever and the joint movements are not restricted. It doesn't look like to be the infection. From the symptoms, you told us that sudden onset, swelling, redness, and previous episodes, it looks like to be a gout. Have you ever heard about the gout? Give the patient a moment to respond and then explain how gout happens when there is a too much uric acid in the blood. This can form very small crystals in the joint, and these crystals causing pain, swelling, and redness that's happening in your case. And then check the understanding. Does that explanation make sense? A very important point here, a high uric acid level supports the diagnosis of the gout, but a normal level during a flare does not rule it out. And then the acute management. Let's talk about how we can treat this flare today. There are three medications which can be given for the gout patient. NSAIDs with PPI cover if they're suitable and safe. Colchicine usually given 500 micrograms 2 to 4 times a day. Maximum 6 tablets in 24-hour time. Do not repeat the course within 3 days. If NSAIDs and colchicines are not suitable, then switch to the prednisolone 30 to 35 milligram once daily for 3 to 5 days. Here, very important point, always check the allergy. Are you allergic to any medication before prescribing? This shows safe practice, very important point for the SCA. Long-term management. If you get repeated attacks, have a kidney problems or have a visible tophi, we consider starting medication such as allopurinol or febuxostat. And very important point, when starting a long-term preventive treatment, these medications sometimes can trigger a flare when started initially. So it does not mean that the drug is failing. We usually give a small dose of colchicine or an NSAID at the same time to prevent that flare. Also talk about the lifestyle, reduce alcohol, limit red meat and seafood, avoid sugary drinks, maintain a healthy weight. And the safety netting, very important. If you develop fever, generally feeling unwell, and if the joint becomes extremely painful, unable to move, please get urgent medical help to rule out any joint infection. And then the leaflet, we have given you a lot of information today. What about sending you some leaflet or website links, and please read about them, and if any questions, contact us back. I will arrange a follow-up in few weeks time just to see how you are doing. And another important point, if it's a telephone discussion or a video call, always call the patient for examination. Thank you.